Hi, this is the Peace of Mind podcast. I'm your host, Maria, clinical development consultant here at Health Assured. Today, our podcast is going to be talking about children and young people's mental health, something that we know is a very important topic, especially these days, and particularly in the UK. Some important statistics that we have, particularly around children and young people's mental health, like we know, 1 in 8 young children and young people in England aged between 5 and 19 have at least one mental health diagnosable condition. Today, I am joined by the wonderful Zoe. Zoe has over 10 years of experience working with children, young people and families across various different sectors within the NHS, within non-profit organisations as well, and you're currently working within the clinical team in a borough, in a council. Zoe has worked with families and children and young people across various stages in life, across various ages as well, children and families who have various needs as well. So you're actually also a trained drama therapist. You qualified in 2020 and you're currently working and training as a systemic therapist. So Zoe, thank you so much for joining me today. It's lovely to have you here.
For having me.
So tell us a little bit about perhaps your role, about your training as a drama therapist. So what sort of things do you tend to come across? What is, for example, as well, systemic therapy?
Oh, okay. So, I suppose I can start with what is drama therapy and what is being a drama therapist. Yeah. So drama therapy is a form of psychotherapy. So we draw on similar ideas that you might have heard of, things like attachment theory or, theories of child development. So we're drawing on all those kind of therapeutic ideas, recognizing that our past experiences have a impact on how we might feel and relate to others in our current lives. But then we're also bringing in the creativity and the theatre. It's a form of creative arts therapy. There's lots of creative arts therapies out there. There's dance and movement psychotherapy and art psychotherapy and play therapy. And I like to say that as drama therapists, we get a bit of everything. Because if you think about the theatre, you've got the lighting and the sound and the set design. You've got the costumes. You've got maybe music and movement and dance in the theatre, but you've also got character and story and role. And so as a drama therapist, I feel like I'm a bit lucky that I get to kind of draw on a bit of everything and really respond to what young people's skills and talents are and kind of building on those and where they'd like to take the sessions. Yeah. So it, with one young person, it might look like making stories and working with characters from those stories. And others, it might feel really uncomfortable and something more kind of like to do with art making might be more interesting for them. Yeah. So really it's about kind of working through difficulties but using that creativity.
It's such an interesting profession, and you and I have had conversations outside of the podcast, and in fact Zoe and I know each other quite well. Zoe used to be my manager at my previous role before joining Health Assured. We used to work within the NHS, particularly with children and young people. However, we worked more in sort of educational settings. So, yeah, that I have a really personal kind of interest in the kind of creative arts and the therapies in particular. And I think we've had conversations in terms of drama therapy often not being known or potentially, quote unquote, respected as like a clinical practice, as like something that is therapeutic and is actually a HCPC accredited profession. Yeah. So, for those who potentially don't know very much what it takes to be a HCPC accredited psychologist or within the profession, it's incredibly difficult. It's very thorough, and it is a very, very difficult thing to do. And there's loads of processes to it, kind of proving your work and supervision and like portfolios that you have to present and a variety of different clinical conditions that you've worked across. So, yeah, often we know about, clinical psychologists or psychotherapists and so on, but drama therapy doesn't really get recognized so much as a very, important and also very clinically relevant a profession.
Yeah, so. And in fact, you'll probably find drama therapists or some form of arts therapist in lots of multidisciplinary teams. So, I'm currently working in a local council as part of families in a family services team. And that's made up of lots of different, in my team is a clinical team, and it's made up of lots of different professionals who work together to think about children and families, and then we draw on our different skills to think about what might be most helpful. And similarly, when we were working together in a child and adolescent mental health service, there was a similar, situation where we were working across different modalities and drawing on our strengths. And I think that actually there's a lot of drama therapy that's also about influencing other people's creativity in their therapeutic practice, and encouraging others to kind of bring that creativity to their work, because often there's only kind of one creative arts therapist in a team, but actually that creativity can kind of filter through into lots of other people's work as well. And similarly, I feel like I benefit a lot from my colleagues who for example, my team at the moment, my manager's a systemic therapist, and there's other systemic family therapists in our team, and they've really influenced the way that I think about families, and made me think about, well, how can I actually use my drama therapy, but thinking about the systems that children are in and are a part of, so that actually it's not an isolated piece of work, but the work is really having an impact on kind of how that child relates to the people in their lives, and the people around them are supporting them in a way that helps their mental health outside of the sessions, not just inside the session.
So we've mentioned systemic therapy.
Yeah.
Do you want to just talk to that a little bit, kind of maybe perhaps like a brief overview for those who mightn't necessarily know exactly what that means? And
sure.
Because obviously our podcast today is around children and young people's mental health, and potentially how would that link? Do you want to just kind of talk us through how that kind of systemic therapy and how it links to children and young people, perhaps?
Definitely. So first of all, I'm going to do my absolute best, but I am just doing my foundation year. So I'm drawing on those, the ideas that I've learned so far, but I don't want to kind of give off any impression that I'm a systemic therapist.
Valuable nonetheless. So valuable.
But I suppose that the way I see it at this point in my career is that children don't exist within a vacuum, and children's mental health doesn't just exist as, anxiety or depression or, it has a relationship to something that's in their lives, and that might be, how they relate to their immediate family. It might be something much wider about something that's going on in their community or globally as well. And then you think about all the kind of dominant narratives in our world, like stories, racist stories, or stories of kind of discrimination that might be impacting on a child's individual experience. And so when we think systemically, we're thinking about all of the things that are going on around a child that might be impacting on their mental health. So when I do my assessments, I'm thinking about, is this child suitable for drama therapy? And we can maybe talk a little bit about that in a moment.
On that,
but kind of also, what are the things going on in this child's life that actually therapy won't change necessarily? So what are the other things that we need to be thinking about? Because therapy can't happen in isolation. It needs to be part of that system.
That's right.
And, particularly I'm thinking about families where, they might desperately want, something to change for their child. Maybe they're struggling to go to school, or they're feeling quite socially anxious. But, there's something in that behaviour is a communication. And they're only going to overcome those difficulties in relation to the people around them. And so the individual therapy with a child will take us so far, but it's got to come back to family or whatever, and whatever family looks like to them. It doesn't have to be a kind of traditional family. It might be a family. It's their support system, whatever that looks like for them.
Kind of broader. And I think it's such an interesting thing as well, because a lot of the calls sometimes that we get as well as an EAP service, we do have sometimes parents or guardians or adults that are calling in out of potentially concerns around a young person or challenges. For example, parents, let's say, who work quite demanding roles, potentially don't manage to spend a lot of time with their children, and they're finding kind of potentially the knock-on effects of that, and they have concerns potentially about how they can work around that, how they can kind of manage the work-life balance, if potentially they don't have a choice of reducing their hours, they don't have a choice of going part-time, and they're struggling to sort of juggle parenthood or you know, being responsible for a child whilst, you know, maintaining a full-time job. And I think what you said there in terms of systemic therapy, looking at the wider network, we understand how it's not sometimes just mom and dad or just the parents. It's aunties, uncles, maybe older cousins, maybe the grandparents,
after school clubs, and
teachers as well, and
hobbies, interests, like everything.
So we sort of all kind of, as adults, have, to an extent, of course, everyone's slightly different, but we have a responsibility to just look after those children and what we can do as the adults to support them around their mental health. And we know, like we said, is such a massive thing these days with children's mental health. And we know it's not just an isolated sort of incident that, oh, it affects my mood, or it affects my social interactions, or it affects my home life. It's affecting their education. It's affecting their social interactions, their friendships. And you and I were talking earlier how it impacts everything. And it's, you know, every child has their developmental stages that they need to hit, and socializing is one of them. You know, having a secure attachment with a parent is another one. And there's, it's I feel like we could go everywhere. We're talking about children's mental health, but it's important to kind of recognize just how everyone plays an important role, and it's not just parents alone. That kind of adults, you know, within a child's life have the ability to make a difference.
And you make an important point there about kind of the pressure on parents. And the thing that came up for me as you were talking about that was kind of, what's the conversation about that at home? Yes, sometimes like the circumstances can't change. You know, there are bills to pay. There are, you know, multiple responsibilities that, you know, parents have to juggle. But it makes me think about, you know, what's the communication about that? What's the understanding of each family member? You know, is the child thinking that they're just like, you know, that work always comes first and they're not a priority? Or is it that actually, you know, there's kind of another narrative there, and the beauty of kind of family work is that it kind of opens up the opportunity to have multiple stories and to kind of hear multiple stories about one particular situation, and then, you know, to find ways to meet in the middle or to make compromises, and actually there are probably compromises there that are possible, but maybe until you're having the conversation don't quite realise what those small changes might be, that difference that makes a difference, really. That's something that we talk about a lot in kind of systemic practices. You can't ask somebody to completely change their routine, and, you know, but just what is that small difference that makes the difference?
And you would know that really by having a conversation, by opening up the topic. And we know for adults, you know, generally speaking, but also it's even more difficult to kind of open that conversation with children, because some people might argue you're opening up a can of worms and potentially you're not necessarily the best equipped as to how to respond to that. And if a child says a particular word, or they open a particular topic, they might stump you and you go, oh my God, I don't know what to say. How do I respond to that? So I suppose I wonder, in terms of, I mentioned that because I'm wondering, where can drama therapy come in there? Sometimes it's hard for children to say things using their words, depending on their age. Potentially they're very young. Perhaps parents or guardians or adults in the child's life are noticing behavioural differences. They're noticing something is shifting potentially in the child's personality. Their mood is shifted, and the child can't explain themselves. They can't say, oh, I'm feeling really annoyed because I don't know, I'm sad, or because whatever. Using their words is hard. They don't have the vocabulary. Perhaps developmentally they're not quite at their stage where they're in tune with themselves as much as an adult would be.
Absolutely. And we sometimes have these expectations of children to be able to explain themselves and explain why they're behaving in the way that they're behaving, but they might not actually have like you say, this kind of they might have not met those developmental milestones yet that mean that they're able to articulate what they're experiencing. And also, why do they have to communicate it in the way that we want them to? Why can't they communicate it in the way that they want to? And, it just makes me think sometimes about the expectations we have of children at certain ages to be doing or thinking things. Yeah. And, so behaviour to me is a form of communication. Everything's a form of communication. And our job as adults is to be curious about, what is this behaviour communicating? And maybe sharing that with them, like hypothesizing with them. Oh, I'm noticing this, and I'm wondering whether it might be because of this. Sharing those kind of hypotheses that we might have about our children and what might be going on for them, and they might completely shut that down and say, "No, that's absolutely not what's going on," or that might actually be like
you understood, you figured it out.
Yeah, or maybe it might be quite subtle, and it might be like, actually, that was what I was feeling, but I can't quite admit to that right now, but maybe I'll show you in another way that I did really appreciate that. But to answer your question about kind of drama therapy and the value of drama therapy, when maybe finding the words isn't possible, or it feels too difficult, or the words don't do justice to what we're feeling. Well, one of the most valuable things about drama therapy is that we use all of us, our whole bodies. Right. And, I think we're kind of trained to kind of really notice kind of the behavioural element of kind of a child's communication, and not just what they're saying. And so, that can really help to kind of really focus on kind of the body. And it also means that actually we can kind of take on different characters, or tell stories in a kind of indirect way. So for example, it might be really difficult to say what's going on, but there might be a character can tell a story that's quite similar. And so actually by acting out that character, there's what drama therapists would call the aesthetic distance between ourselves and the story, that creates a bit of safety, and it feels a bit more gentle to be able to kind of take on a role, or to kind of create an image that describes what's being felt rather than using words. So it creates that distance.
I assume as well it might come not necessarily as not an excuse, but potentially kind of that wasn't me, that was the character that wanted to express that emotion, but then nonetheless it's still therapeutic for the child, and it's still kind of an option for the child to express themselves or release their frustration, but without saying, I'm feeling this and I'm feeling that, and it was me that expressed this, and I wrote this down. It's like, no, that was the character who wrote it down, and that was the character that expressed it in that way. And I guess so for example, what might a typical drama therapy session look like for a child? What's potentially the main sort of things that you come across, and how do you approach that, for example, in a session with a young child? Or not necessarily a young child, kind of any young, a person.
Well, it's funny you say that, because the first thing that came to mind as you were talking was some adolescent children that I've been working with, where this idea of having different aspects or different parts of ourselves becomes a really helpful tool to talk about experiences. So rather than, I am Zoe and I am a drama therapist and I am this one thing, this one-dimensional, character, if you like, or aspect of myself, it's about being able to map out creatively kind of all the different parts of us and all the different stories that those different parts of us might have, all the different parts of us
might display, perhaps.
And maybe that they have a different story to tell. So, for example, there might be a part of us that only our parents see, maybe a very vulnerable part that's, hidden most of the time. Maybe there's a part of us that comes out when we're with our friends. Maybe it's a joker character that likes to kind of be a bit of an entertainer, but it might also be hiding something. Or maybe there's a part of us that's really creative, or a part of us that's really passionate about the environment and wants to do something about climate change, or, and that actually what's really lovely about taking that approach of kind of mapping out different parts of ourselves is that we start to kind of notice, like, we kind of get a bit of a broader picture about a child's world and a child's experience. And they start to notice all these qualities that they have and all these strengths that they have. And they're no longer, the child that's come to therapy because they're angry, or the child that came to therapy because they're anxious, but all of these different aspects of themselves that maybe don't get a look in when the anxiety is really strong, or the anger's bubbling up to the surface. And then we can pay attention to those parts that maybe are seen as the problem, and kind of find out what they have to say. Maybe we can like create a shape for these parts, or maybe we can interview them, or give them a kind of separate life and find out things about them, but at a distance.
Right.
So
is that the aesthetic distance that you were referring to?
Yeah.
Kind of. Yeah. I think I kind of understand in terms of it's. Yeah, kind of, you're interviewing that part of you. It's you, but in terms of the approach in the therapy, you're kind of distancing yourself from it. Perhaps it makes it, I guess, easier to respond to it. It feels less personal, but kind of subliminally, it is you. You're working on that part of yourself.
And if that part was to create its own script or its own story, what would it say? And if I were to interview it, would it be happy to be here today? What would it say if it knew that Maria had let it come to the podcast today and be part of the conversation? Like, would it be really embarrassed, or like would it actually be excited?
Yes.
What would it? What would that part have to say that might be different from other aspects of themselves?
So would that be, for like, when we reference parts, can we also potentially reference, like, are they the emotions that we feel? Is it like we tune in to potentially that particular emotion and give it the platform to be expressed?
It absolutely can be. Yeah, I suppose I sometimes I like to kind of build as much character into them as possible, so that they're not just about the emotion, but they've really got a story behind them. So, how would they walk around the room? If they introduce themselves, would they introduce themselves, all curled up and timid, or would they be really bold and confident? And, and then, you asked me about the structure of like drama therapy, and one of the things that we always do at the end is we try to kind of de-roll from all the characters or the parts of us that we've been exploring, and I start to kind of have conversations with the young person, about what they did and what they noticed about it and which bits they're drawn to, and
a debrief almost.
A debrief. Right. And that helps them to separate from what we've been doing, which is about creating containment at the end of the session and making sure that actually when they go home to their mum and dad, they're not still kind of living and breathing these roles in a way that maybe won't be, that's safe for them, in other aspects of their lives perhaps, or, might kind of be a bit confusing for them perhaps. But in that kind of de-rolling, that child can then start to make connections if they want to with kind of how does this apply to me, and what's the connection that I'm making with what we've done today. And sometimes they might have nothing to say, but my sense is that something's still happening, even if it's not necessarily been articulated. And my job isn't to get them to a point where they're necessarily verbalizing it. It's great if they do, but actually it's their process, and it doesn't always have to be kind of communicated outwardly in a really clear way that says that means this and this means that. Am I making sense?
You are. I'm following. I mean, to me, you are only. I don't know about the listeners. No, I'm following. I mean, it sounds like it's, again, I think that goes back to the idea of it kind of, it does hold that real clinical value in terms of you create this safe space for a young person. And it's not to say that drama therapy is strictly for children and young people. It's applicable to adults. We've worked in settings where, we use drama therapy for adults. But in this particular podcast, we're talking specifically around children and young people's mental health. And I think it can be quite daunting, for example, to potentially go into a psychologist's, therapy room. And there's that kind of stigma that comes with it, that the nervousness that might come out of it, and it feels very, potentially for a child or a young person, very artificial and very hard, and potentially, like we said, the only way you can express yourself is using your words, is telling the professional how you feel. But I guess drama therapy just gives them an option. It gives them all I can think about is option now. It gives them another kind of a route that they can take where they can still express themselves. They're still validated, they're seen, they're heard, and they still get the clinical value from it. And they have the safe space, like you said, of stepping back, right? Let's, like you said, de-roll. Let's get out of this character. Let's talk about this now. We've had the chance to kind of explore these parts of us, these emotions. How did that make you feel? How, what did that mean? Or was that you? Was that the character? Why did you want to express that? And so on. And I think you mentioned something there in terms of the different parts of us, perhaps the different emotions. How would they walk around the room and how would they come in and so on? And I remember when we used to work with the children and young people together, we often referenced the movie Inside Out, which I think really helped the young people we were working with to visualize and understand their emotions, because they had these characters that they saw happiness, and they saw that sadness was little and blue and wore the glasses and was timid, and anger had the fiery head and so on. And I think drama therapy to an extent helps to create those images in the head potentially as well. Kind of they allocate what their character looks like, and they allocate what, how they might walk into the room or so on.
Absolutely. And it's just reminding me of children I've worked with that really love the Marvel's characters or, really love Harry Potter. And then, we have conversations about, different aspects of themselves in relation to Gryffindor or Slytherin or the Hulk and Princess Peach, or that actually there's so many characters out there that we can relate to and use that as a starting point. And sometimes to start a session I might just have lots of different images on a table, for example, and it might be images of kind of wildlife, or it might be, animals are great for talking about kind of feelings and emotions, and inviting someone to just check in rather than how was your day, is there a picture here that reminds you of you today, or could you pick a couple of pictures that remind you of kind of how your day's been? So they might say, I picked a lion because I felt really brave when I did my SATs exam this week, or but that leopard on that rock looks really sleepy and I'm quite tired now. So it's just being able to kind of see an image, and then that's the opening to kind of have a conversation that might not be there if you just say, how are you? Because it's just too overwhelming for some people.
Broad as well, and you have to use your words. I think the reason we just kind of link it back, the reason we're talking about this in terms of what drama therapy looks like, and for example some of the tools that you use and so on, is to potentially equip our listeners or our viewers of the skills that maybe they could apply when they go home to their children, or when they're around the children in their family or in their life. How, for example, might an adult take some elements of drama therapy and use it at home with the children in their life? How might they use drama therapy? I guess, how would they become a drama therapist? Not to say that, but as in, what parts of drama therapy would you suggest parents use at home or adults kind of use with the kids in their life?
Okay, so
It's a big question.
I know, I feel like I've got like so many different sparks of like ideas going off. So I'm going to take two approaches. One is just following up from what I was just saying about the postcards or the images.
Yeah.
Those images everywhere. Posters, signs, Google Images will bring up a whole host of different pictures of animals and so on. And it might just be that you've come across something on the telly or a character, and there's an opening there about like, do you ever feel like that character? Or, I feel a bit like him today, or, they look a bit like how I was feeling earlier, and you start to kind of use the metaphors of kind of what's out there in the world to have a conversation. And it's just a kind of indirect way to open up a conversation about feelings with your children. I think the other thing is a model we were talking about earlier.
The
PACE model. So PACE is an acronym, and it stands for playfulness, acceptance, curiosity, and empathy. And play is such a huge part of drama therapy. I once heard this kind of, I can't even remember who it was now, but someone said to me, you can't be playful and stressed at the same time.
Right.
And I just feel like that's such a helpful analogy, because actually playfulness is when we're creative, it's when we're connecting to people, it's when children kind of see us in our kind of
I guess in our childhood state as well, we let go of our inhibitions and perhaps get down to their level, something that they can connect. Yeah, absolutely.
Absolutely. And there's so many different ways that we can play, like to start with, like our senses are such an important part of our play. So, things like slime or making Play-Doh or, connecting over something kind of that really kind of, grounds you. Yeah, it can be really soothing for children. Also, just that experience of making a mess and it being okay and getting it wrong, and kind of, that's all part of kind of building trust in relationships, of
problem solving as well.
Yeah, and problem solving.
Some parents might hear that, making a mess and clearing it up, and go, absolutely not, have mud all over the place and whatever. But that's really interesting in terms of like, making a mistake and problem solving it together. And I guess giving the child the autonomy is like, what should we do? We've made this mess. We've made, a mistake here. Oh no, what do you reckon we should do? Let's give you the chance to find a solution.
Rather than a maybe more shaming approach, which is, what have you done? Which is kind of what we naturally respond to, because it's a mess. Or it could be outside. It doesn't have to be a mess inside. It could be a mess outside. So I'm just thinking about, I'm going back to my childhood now, but it was all like mud pies and, houses made of sticks and, paths made of stones and what's under this log.
And little potions, bits of grass and mud and water and all that.
Exactly. You don't need like really fancy gadgets or the latest thing to kind of have that kind of sensory play. And sensory play is something that we do very, very, very early on in our development. If you think about like rattles and, babies are putting things in their mouths almost instantly to kind of soothe themselves. And so that kind of sensory play is something that is really an important part of those kind of early stages of development. And then we kind of stop doing it. And that's okay. But sometimes it's nice to go back to those early stages of our development and kind of reconnect with those kind of sensory play aspects of ourselves. And then there's I suppose kind of projection, so making images and worlds together, so objects and landscapes and is it a train set or art making, clay, things that you can create together. And there's something in co-creating something.
I was going to say something about like teamwork and connecting and sharing an experience together, and I guess having the mutual sense of achievement once it's done, and like yay, teamwork, and maybe a high five and so on. And I guess it creates that bond as well, kind of co-creating. Totally. And
these are things where actually, for a lot of children, they struggle with like, the winning and the losing that comes with a lot of games, like that are played in school or kind of, even gaming and things like that. And actually all of these things are kind of free from that, or at least they're not kind of, there's no winning and losing in the same way that there is kind of when you're playing a board game.
Games,
so, it can be a bit of a relief from other types of play that maybe we kind of get more drawn to as we get older.
So that's the playfulness aspect of it.
Thanks for looking.
So we're encouraging parents and to potentially follow this pace, or not just parents, adults with children, this pace model. So we've got the playfulness, you said attentiveness, was it?
So it's acceptance.
Oh my goodness.
So but attentiveness, I think, is part of acceptance, actually. So there's something about showing a child that, that they're free to be them, and that they can be they can be them, and not just like a kind of who
they're expected to be, perhaps.
And there are parts of their lives, and especially at school, I imagine, where there's grades and things that they're kind of expected to achieve, that where maybe that doesn't feel the case. So I think our role as parents, but also kind of caregivers in general and professionals, is to really show that acceptance and kind of normalize the fact that we're not good at everything, and it's about finding our skills and finding our the things that make us unique, and really celebrating those and showing children that they are special, and that they've got a lot to offer in the world. And that's really empowering, I think. And we don't always do that. We can sometimes get into kind of a rut where we're kind of so focused on the thing that they're not doing that we're not really focused on the thing that they're doing.
Yeah, it's often that we focus on the negatives, and it comes for adults' mental health, it comes for children's mental health, and even just behavioural things. I think I heard like a metaphor that was used that often, like, the negative emotions or negative experiences stick in our minds like Velcro, whereas the positives slide off like a non-stick pan, like a Teflon, where we often just let the positives pass and go, oh yeah, well, that's just expected. And the negatives really tend to stick. So I guess, what I'm hearing is that parents to really recognise the positive behaviour and reward those potentially, or at least kind of recognise and mention and say, well done, you were really good today. Yeah, so kind of paying attention, I guess, as well, and accepting the positive behaviours as well.
Definitely. It's reminding me of some of the work that we used to do together. And just that kind of, that so much of kind of addressing, like, the behaviours that challenge with children is often actually about focusing on
the positives.
The positives.
Which could be hard for a parent to do sometimes, for example, after a long day at work, or particularly, they might have had a particular tantrum, or, I'm not a parent myself yet, but I can imagine it's not easy to juggle, your work life, your social life, your responsibilities as an adult, and the demanding needs that a child has. And it's not a straightforward thing of just kind of, well done for this or well done for that. It can be hard for parents to, even recognise that their child has done something good. So perhaps, there might be some techniques or some methods to encourage parents to see the good potentially in the bad, and even the most minor things of, oh, well done, you brushed your teeth tonight without a fuss, or I really like the way you put your socks on by yourself, you didn't need any help. Or sometimes the things that get missed easily, perhaps on a particularly tough day, or potentially after a particularly awful tantrum, the things that we would often miss, potentially focus on those and mention them as the positives. Because I can only imagine it's not easy to be a parent, and there's a lot of demands and pressures on them, but in general, never mind potentially if you've got a child with additional needs or particular behavioural challenges as well, that can be really, really hard. So there are options there in terms of things that they can do to really focus on the positives as well.
Absolutely. Should we move on to curiosity?
I think so, yeah. So we're PAC.
So curiosity is C. And I really like this one because I
It's intriguing.
Yeah, there's something about, when you take a curious approach, you don't know. There's something about, I don't know, but I'm going to have a go at trying to understand. And I think that's kind of, as therapists, what we do all the time is like, I don't know for sure what's going on, but I have an idea that I'm working with, and I might share that idea sometimes, maybe with a family member or, with the child. Yeah. But actually, it's only through that curious approach that I really kind of would ever get to a sort of idea that, I'm wondering if what I've been seeing is this. What do you think of that? Yeah. And it's a much more gentle way of kind of
interviewing or sitting them down and be like, what's happening, what's going on.
Yeah. And it's kind of, you're doing a bit of the work for them, which is actually our jobs. Actually, show that we've kind of been
in tune with them, I suppose.
Yeah.
Like, noticing their behavioural changes, like you're paying attention and you're opening up the conversation of, I'm curious if this is this, I'm curious if this is that. So, yeah, I guess, I don't know, correct me if I'm wrong, but I assume the curiosity aspect gives the child a bit of recognition that they are being seen, they're being heard, and they're being noticed, I suppose.
Absolutely, but also gives them the permission to say, you've got it completely wrong, or that's not what I was experiencing.
Gives them the sense of autonomy as well.
Yeah,
absolutely.
Yeah. And I suppose they don't have to respond. They, the expectation isn't like, I'm going to share what I'm curious about and you're always going to give me the answer. I might share, like, I've been wondering why you're finding it so difficult to go to bed over the last few weeks, but they might not have the answer. But you might say, and I was wondering if it's because of this, and they might not be able to, but you've planted a seed and you've shown them that you're taking an active approach in trying to understand them, which I think is the most important aspect of all of this, is actually showing them that you're trying to understand them. And you might feel that goes on for years, particularly during adolescence. You might find that there's really few and far between those moments of, I feel like I'm having this kind of connection with my child where they're really telling me, what's going on for them. But actually that perseverance is so important too, and it's just another P, perseverance. But
I think that was something I was going to ask about as well. I mean, we know younger children, perhaps it's potentially sometimes easier to tune into their emotions because as a parent you know them quite well, or as a guardian or as an adult in their life you know them quite well. But the teenage years, they're the hard ones, and you get to the stage where your children or the child in your life is going through their own challenges, potentially. We know that exam stress is a huge one. We hear from a lot of parents, for example, that call in for support that, their child is going through their GCSEs or their A-levels, and it's impacting the child, but it's impacting the parent, it's impacting the family, potentially impacting the parent's relationship, and it's, relationship challenges and so on. So I think what you said there, potentially another P in terms of the perseverance and just the curiosity and the knowledge for the young adult to know that I'm here regardless. We might butt heads. I might be talking to a brick wall where I'm talking to you and I'm not getting anything back, and that's okay. Yeah, it's okay. You're still doing enough for the young person to know that you are there and you're an option for them. I think potentially the most difficult thing for young people, specifically with the hormonal changes and the challenges that come with being a teenager, is that they feel like no one knows what they're going through. You don't understand, and it's me, and we've all been through it where mom and dad don't understand what I'm going through. I'm unique, but and they feel potentially isolated, that no one can hear them, no one can see them, no one understands them. But having the option of someone's there, I think, can be quite reassuring. So even if, I guess, for the listeners, for any adults, even if you're met with resistance, if you're met with kind of a block, don't give up. It's helpful for them to know that you're there if they need you.
And I suppose there's something about we can sometimes feel quite rejected.
That's kind of the resistance and the rejection. Potentially we feel that we look stupid and we're trying to like help them, and then we get shut down. And
Totally. And I get that with young people that I'm working with, like, you know, sometimes they don't come up to a session or, you know, like something like that. And I think, oh gosh, like, what do I do? Is it me? But actually, you know, that's something about, most of the time anyway, you know, their process and what they need. And like, there's something in that we can talk about as well. And it goes back to this acceptance idea as well. And you were saying about the compliments and those not being able to kind of be absorbed as much as the maybe the negatives. And actually during adolescence that spikes. So I'm not sure if the maths or the ratio, but it kind of escalates. So kind of what an adolescent brain is able to hear is say, for example, every 1 in 10 compliments is heard by a child, whereas an adolescent, like maybe 0.5 or, you know, like it really drops. So there's something about actually the acceptance and the kind of validation that teenagers need is like even more.
A little bit extra,
even more so, Do you
want to talk to the E then? Of the pace.
Yeah, so E is empathy. And I think we talk about empathy all the time, but sometimes we don't really do it in the way that we kind of mean to do it. So I really love this like video that I've seen on YouTube a few times with Brené Brown, who has this kind of conversation about empathy where she talks about the difference between empathy and sympathy and how you know, the kind of sympathy is kind of looking over this like deep dark hole where someone's at the bottom of the pit and kind of says, oh, looks rubbish from where I'm standing, but doesn't really kind of get in the hole with them. And
pity,
maybe pity, or kind of a kind of empathy. It's like a distance. Like I'm not going to get involved in that, you know. It's kind of, whereas empathy is really sitting with someone and really feeling what they're feeling and kind of helping. You know, you don't have to fix it. Often that's not what people need. They just need to be heard. And children often, you know, they don't want another problem solver. They don't want someone to come along and, you know, fix it for them. You know, they want to find their own way. But that empathy is just about sitting with them and validating what they're experiencing and kind of acknowledging that if you were in their position, you'd be feeling it too. And not going into problem solving. I think that's a big thing about empathy, is that sometimes that's our
automatic response. Even as adults speaking to adults or friends or families coming as well, we feel the need to give an answer and give a solution, and sometimes you might feel like, I'm not equipped to do that. I don't know, you've given me this big thing. And sometimes it's not about you finding the answer or finding the solution. It's just, I just needed an ear to listen. I just wanted to kind of offload. And it's almost, I don't want to say an honour, but it's nice that this person feels safe with you to tell you this, and they're not coming to find an answer from you. They're just you're just someone that they trust enough to show this vulnerability to. I suppose. And it's especially with children, if they've reached the stage where they're kind of open enough to tell you how they're feeling, take it seriously. Don't necessarily kind of brush it under the carpet, especially if you've got a teenager. It's even harder, like you were saying, in terms of teenagers feeling, you know, comfortable enough to express themselves. So I guess for parents or guardians or the adults around a child's life, you know, when they come to you, take it seriously, I suppose, and see if there's any aspects of potentially what we've discussed in terms of the drama therapy approach or the PACE model that potentially during that conversation you can bring in to give them that sort of safe space, I suppose, to discuss. So if we're thinking potentially for any parents that perhaps might be curious now about drama therapy or introducing their child to drama therapy, how would you know potentially a child that is suitable for drama therapy, or actually that's absolutely not what they need. Kind of when you do I know we've discussed that you do quite thorough assessments, but so for example, that a parent that's kind of got a particular child with a particular challenge, what sort of behaviors or challenges would you think kind of fit with drama therapy, perhaps those that don't potentially?
Okay, so I'm finding it hard to think about instances where a particular type of difficulty wouldn't be suitable for drama therapy.
Wouldn't.
Okay. But having said that, it might be the question of, like, does this child need therapy right now? Do they want therapy right now? If the assessments are very much just as much about me understanding what might be helpful for them and what the work might look like, as much as it is about them testing me out and being able to go, I like the sound of this, or actually no, this is really not my thing. So I think actually it's down to the child to say this isn't suitable for me. And I think one of the things that I have to keep being really mindful of is that children communicate that in lots of different ways.
I think it goes back to, it's not always words. Sometimes there's loads of different things that you can read with the children.
So it feels like a kind of organic process when it comes to working out if a child kind of doesn't want to engage or access therapy at this time. And that might be for a really valid reason. Like, they might be thinking, I'm not the problem. The problem doesn't sit here. It sits somewhere else. And they might not be able to articulate that. Right. And so there might be something in kind of actually, going back to these ideas of systemic work, is actually, part of the assessment is thinking about what is going on around the child. How do we as a family, with the child and the parents or carers or the professionals in their life, understand what's going on for them, and how does that inform whether a drama therapy approach would be helpful at this time.
Right.
So to give you an example, I currently work in a team where a lot of children are on open to kind of social workers. So they have a social worker allocated to them. And there might be a reason that they're open to social care because of concerns around parenting, for example. And that's not to say that that's the parent's fault. There might be multiple things going on around that family that have kind of led to those circumstances being the way that they are.
Yeah.
But actually, if the child's presenting in a certain way, like they're not going to school, or there's, maybe their behaviour is becoming a concern or something like that, actually by addressing that symptom, if you like, you're not addressing the problem. So when I think about when is drama therapy most helpful, that's the thing that I want to start with, is like actually what's going on around the family and kind of what, when would it be most helpful.
Right.
There are families where, there are children that I work with that have maybe been through something, like they've experienced a trauma, and it's kind of quite separate to what's going on in the, not separate, but kind of maybe they've come from a war-torn country, or asylum seeking children who've experienced abuse and neglect and are now looked after children. Children who've been through a bereavement or have experienced significant change, like their parents separating, or something has happened that might have kind of triggered a response that might require some kind of therapeutic intervention. So I think about kind of what the trauma might be, and kind of what how the child has experienced that and made sense of that, and might want to explore that in the work. And then I'd be thinking about how might the adults in that child's life be part of the therapeutic process as well. I feel like I might have gone on a tangent.
No, I think you mentioned a few things there that were quite interesting for me. And I think, like I mentioned at the beginning, we could go on for forever. There's just so much to discuss around children and young people, and they're just fascinating. And then developmentally, it's you know, we all know that it's, you know, a childhood is important and childhood is very valuable, but, you know, in our kind of education in psychology and kind of learning, you know, the understanding of childhood development, we know that there are kind of critical stages within a child's life that, you know, particular trauma, particular events can really shape their future. And I think potentially one thing that you and I were kind of chatting about earlier is that some parents might think potentially, oh, you know, my child's 12 or my child's like 15, 16. It's just too late. I can't possibly kind of solve this now.
Repair something that's happened.
Repair, exactly. And they might think it's just too much hard work. It's something that's ingrained, you know, potentially, you know, that's just how they think or that's just their personality and so on. But something, you know, we mentioned before is that it's never too late, and our brains are constantly learning, constantly developing. There's these constant connections that, you know, with every experience, with every, you know, skill that we learn and every language that we learn, everything that we do, it's learned and ingrained and maintained in our head. And I think one thing you said is that if there's the option to catch it now as a 7-year-old, it's better to catch it now than to catch it at 13.
Yeah.
So kind of being proactive, I think, as soon as you kind of notice a behavioural change or notice something happening, to take the action.
Yeah, and I'd say with the caveat that action might not be therapy straight away.
Yeah,
it might be a watchful waiting stance where we kind of, you know, really kind of observe kind of, you know, how are we making sense of this child's experience and what different adaptations can we make to their environment that kind of mean that actually we are responding, but it's not necessarily therapy. And I suppose, because we can't ask a child to process their trauma when they're not ready to process their trauma.
Yeah.
And I think that's really, like, I've come across so many concerned and caring adults who have seen children go through really horrific situations and want to do something to make sure that child has processed their experience.
Right.
But actually, like, it might not necessarily be right now that they need to process it in the way that we might think they do. So there's something about, you know, what conversations are they having with the people around them? Who do they trust? You know, what's already in their support system? Is it an art class or going to, you know, dance school or on a Saturday or something that helps them to kind of process things, but in a kind of indirect way?
Yeah.
And, you know, build connections, form friendships. You know, so much of trauma recovery is also just about creating the foundations for success. Yeah. And then when they're ready to talk, when they want to access support, doesn't have to be talking, I have to say. But, you know, when they're ready, then of course, you know, we need to be ready. And I think the challenge with health services at the moment is that there is a lot of children saying that they're ready for support and there's not enough support available.
Yeah. I think you mentioned something there in terms of kind of not necessarily going, you said like many adults are wanting to have the child process the trauma now and potentially the child isn't ready. So to an extent, potentially following their lead. But in order to kind of know when to take the action, you need to be intuitive enough and give them the space to express that to you. And again, that goes back to the PACE model and giving them the space to be, you know, playful, and you being, you know, is it attentive?
Accepting.
We're changing it now. It's going to become attentive.
Attentive is a great alternative.
So if we're thinking potentially for any adults, because you and I can talk forever on this, but for anyone that's listening, if we think about potentially like some takeaway messages, if you can give potentially a takeaway message, some tips, some tricks, some advice for parents or adults in a child's life, how can they support potentially children and young people who are going through a tricky time? Quite heavy. So we've talked about things like adopting some aspects of drama therapy to kind of give the opportunity for children and facilitate the opportunity to express themselves without using their words, which can be hard to do.
I mean, a few things I maybe haven't mentioned. First of all, that like you don't have to be a performer to be, you know, or an art, like consider yourself to be artistic to come to drama therapy. In fact, like a lot of people that come to drama therapy discover their creative selves in drama therapy. Wow. So, you know, it's taking a strengths-based approach. So, you know, there might be a few people that kind of think, oh, you know, they go to drama class, they'd love this. And yes, absolutely, we welcome referrals from children and young people who are already being very creative in their lives. But also there might be young people who are being creative in ways that might not necessarily be kind of art and dance and drama. You know, it might be that they're creative on the football pitch. And then, you know, our conversations are about football players and like, you know, so it really doesn't have to be kind of a specific kind of creative young person.
And so for the parents as well, I guess it's encouraging to kind of say, you don't have to be a performer to know how to be playful. You don't have to, you know, have a background in psychology even to be playful and have those conversations.
It's just the childlike parts of us that have always been there, and just connecting with those actually.
I think that's the real benefit, and something that's so attractive around drama therapy is that they get to see potentially an adult in a child. And I know it sounds a bit like wishy-washy, but they might see adults as very kind of the rule makers and the ones that maintain, you know, structure and routine, and the strict ones, and they're the ones we have to listen to. And it's hard for them to see adults as someone that they can relate to, perhaps. So having that kind of the playful aspect of it, and you know, coming down, I suppose, to the child's level and creating almost a friend with the child. You're not just a parent, you're not just an adult and who's strict in this, you're also their friend. You understand them, you play with them, you do this and you do that, and kind of creating that safe space where they feel potentially reflected and seen. And
being a parent can also be playful, or being absolutely. A, you know, professional can also be playful. And we can be playful all the time. Well, maybe not all the time, because there's sometimes we have to be serious. But you know, there's something, we can bring playfulness to lots of things, and I think sometimes we forget how to connect with that. And that was one of the wonderful things about training, actually, was just connecting with my playful self and reconnecting with my kind of, you know, my experiences of play growing up, and kind of recognizing how valuable those experiences were in my own development, you know. So, you know, maybe that's something for the listeners, is kind of think about, you know, what were those playful moments in your childhood, and, you know, connect with them. How do they make you feel? Like, you know, what memories do you have of play growing up? And, you know, what are the ones that you might want to kind of introduce into your children's lives? The other thing I'd say is that drama therapy, as we've mentioned, is a registered title, and it's got its own website. So there's the British Association of Drama Therapy, where there's lots of information about drama therapy, and there's a section called Find a Drama Therapist. So you can put in your postcode and you can find a drama therapist in your local area that's offering drama therapy to children or adults. And you know, a lot of some drama therapists are also doing kind of organizational based work, so you know, maybe group supervisions and things like that as well. So
I think it's worth mentioning that, you know, as much as this podcast mostly is around children and young people's mental health, it's worth suggesting as well that it is applicable to adults, and adults can benefit from drama therapy. And I think as an organizational level as well, sometimes, you know, in teams, in you know, in a work environment, it can be tricky to kind of release that inner child as well, and it can be hard to express potentially one's self within, you know, their work environment. So bringing in a drama therapist might be a good approach as well.
Absolutely. I mean, we do lots of like clinical supervision with the social workers in the local authority that I work in, and we often use objects and, you know, picture cards and things, either to check in and kind of share how we're doing as a team, and then that really builds relationships, because people start to kind of hear a little bit more about how people are doing in their lives, and then we're a bit more aware about kind of not just these kind of two-dimensional people that come to work and complete a particular role, but actually, that they have lives outside of work and they can share as much or as little as they like. It's not therapy, but, it's a way of building relationships, and also maybe kind of, bringing that creativity into other aspects of work. Yeah. So, yeah.
I think it's been such a pleasure, and honestly very, very nice to kind of bring some awareness not only to obviously children and young people's mental health, but to reflect a little bit on drama therapy and the value that it brings for children and young people. And I think potentially for our listeners or the viewers, potentially some takeaway messages might be, the PACE model sounds really good in terms of bringing, the elements of playfulness to your relationship with the children that are around you. Being curious and being empathetic with them. I'm not going to mention the A because I keep on getting it wrong. Attentiveness and acceptance. And I think that it's okay if you're met with a bit of resistance, potentially from the older children, from the young people, by the teenagers. Persevere. Try your best to be there for them. Give them the option. And sometimes they might not choose you. And don't take that personally. It's something potentially that is a personal preference for them, perhaps who they wish to speak to. But giving them the option, giving them that route can be sometimes all they need. They might not even come and speak about it, but just knowing that someone cares enough to reach out and provide that safe space for them is plenty. And, for those parents who potentially have particularly challenging young children, or have a child who's, going through a particularly challenging time with their own mental health, to praise them for the good that they do, to focus on their strengths. And I think you mentioned within some parts of the drama therapy, you focus on the good parts of the child and the positive characters that they have. So, kind of really honing in on that child and telling them that there is so many valuable things in them and they are so needed and they are so wanted, but life can be challenging and they go through these behavioural challenges and the mental health challenges, but they are cared for and they're validated and important.
Absolutely, yeah. And those parts that might be seen as the problem, they've got a voice, they've got something that they're trying to say, and I think sometimes it's about being curious about what's that about, because the symptoms of depression or anxiety or anger are communicating something, and that's where the curiosity is so important.
Absolutely.
Yeah. So thank you so much for having me today.
No, thank you for coming. I hope our listeners have taken something valuable, and it's such a pleasure to have you. Thank you, Zoe.
Thank you, Maria.